6 on your side at 5 starts now.
Hi, I'm Governor Brad Little. My fellow Idahoans, I want to reach out personally to let you know Idaho is carefully and closely monitoring the novel coronavirus.
Heads of Idaho government come together to let us all know health and education leaders are on the case and preparing for a likely outbreak of the COVID-19 or coronavirus. Good evening. Thanks for joining us tonight. I'm Don Nelson. Governor Brad Little announces a task force to help gather information about coronavirus and let everybody know how you and all Idahoans can help slow the spread of the disease. Right now, your individual risk of catching the disease is low, but health experts expect the virus to spread. Today, California reported its first death and Washington State its 10th. So far, Idaho doesn't have any confirmed cases of the coronavirus, but public health officials have monitored 35 different people with more tests expected today. Health officials have been monitoring the virus in Idaho since the beginning of January. The public goal for the governor's work group is to slow the spread.
This group was created specifically for that purpose, to make sure that we are coordinated, that we're proactive, and we are prepared at the state and local level to respond for any situation that should occur in conjunction with the coronavirus.
All the leaders stress the importance of practicing good hygiene. The public is asked to do their part to stop the spread by washing their hands frequently and staying home if you feel sick. Idaho's state epidemiologist says the science suggests 80% of the people who get the coronavirus will have a mild illness and recover just fine. She also told us parents with healthy children should not be concerned. Older people with health problems have the highest risk. She says she does have some concerns and doesn't think there will be a cure for at least a year. She also pointed out there will be several challenges ahead because this virus is new.
We can't predict where this is going. I think potentially this is the biggest event since I've been here in '95, and I remember we had West Nile arrive, and you guys might remember that was 2006. That was rough. We had a lot of people in the hospital, but this has the potential to be more impactful than any of those as regards to impact on our healthcare system.
Hans says the coronavirus is slightly more infectious than the regular flu, but incubation period is longer, and that gives the virus more time to spread. Health leaders say the last thing they need is people suffering from small symptoms or breathing problems to overcrowd the hospital system. That's why they developed a website to provide continuous updates on the coronavirus in Idaho. Here's a look at that site. It has data on COVID-19 monitoring and testing and a link to show where the most infected areas in the world are located. We'll have a link to this site for you at our website at 6onyourside.com. Governor Little echoing sentiment coming from global and national health leaders: don't overreact and buy up medical masks and unnecessary personal protective equipment.
But it's even more important now with this issue right on our doorstep. So it's capacity. So if you buy all the hand sanitizer and you buy all the masks, you're actually doing yourself a disfavor because, you know, as if you read Dr. Pate's article this morning, that really doesn't do you much good if everybody else around you is sick.
The World Health Organization has warned of a global shortage in medical equipment. The shortage could leave health workers all around the world fighting the virus unprotected. The WHO has sent out 500,000 sets of protective gear, but those supplies are already running out. Estimates say governments and manufacturers need to increase stocks of protective equipment by 40% to meet bare minimum requirements. Shelves in several Boise stores are being emptied. If you haven't noticed, people are stocking up on bottled water, bleach, disinfectant wipes, toilet paper, and other emergency supplies. The reason? Many are worried, likely as a result of misinformation that they are hearing. That's one reason the Southwest District Health Department set up a call center and hotline as of today to help you get accurate and reliable answers to any coronavirus questions you may have.
If there is calls that they aren't able to answer the questions, they can take a note and pass it off to the epidemiology team so we can call those people back and answer their questions.
Health experts will answer your calls from 8 a.m. to 8 p.m. Monday through Friday. That number to call is on your screen, 208-455-5411. What if coronavirus makes its way into our schools? Would they close for extended periods, and would every student have to go into quarantine? That's what 6 on Your Side asked local districts. 6 on Your Side's Jessica Taylor explains how schools are keeping the teachers